Before we begin, a short note. We've done our very best to gather accurate information from open source reporting, court documents, and international media. If you find anything in this episode you disagree with, or if you have additional details, please contact us. We genuinely want to get these stories right. This case has no political or geopolitical agenda. It is shared for purely informative and educational purposes. Havlíčkův Brod Hospital, September 2006. A head physician sits alone in his office, staring at a spreadsheet of the dead. 40 unexplained bleeding episodes on his intensive care unit in just 5 months. 23 of them share one thing in common. The same nurse was on duty every single time. The drug used to kill was not a poison smuggled in from outside. It was heparin, a blood thinner so common in hospitals that it sat on every shelf, in every supply cart, unremarkable and unguarded. Patients came in for routine surgeries, a cleared artery, a removed gallbladder, and never left alive. This is the story of Petr Zelenka, the heparin killer. To understand how a nurse could murder 7 people and attempt to kill 10 more inside a functioning hospital, you first need to understand where this happened. The Czech Republic in 2006 was a country still finding its footing. It had joined the European Union just 2 years earlier. Parliamentary elections that June had thrown the government into turmoil, and a minority cabinet was struggling to survive a confidence vote. But the deeper story lay beneath the politics. Since the fall of communism in 1989, the Czech healthcare system had undergone a massive transformation, from a centralized Soviet-style model to a modern insurance-based system. Hospitals had newer equipment and better trained staff, but the culture inside them had not entirely caught up. Decision-making was still hierarchical. Problems were handled quietly. Reporting incidents to outside authorities was seen, in many institutions, as making waves, something to be avoided. Havlíčkův Brod is a small town of about 23,000 people, nestled in the rolling green hills of the Vysočina region, roughly in the geographic center of the country. Its hospital served the surrounding countryside, a regional facility with over 500 beds and 22 departments. The anesthesiology and intensive care unit, known in Czech as the ARO, was where the most critical patients ended up. And it was where Petr Zelenka worked. Zelenka was born on February 27, 1976, in the nearby city of Jihlava. He came from a modest family. His parents were high school educated, and he had a younger sister. He studied at a secondary agricultural school before retraining as a paramedic in Brno, eventually qualifying as a general nurse in 2005. His career, however, was unstable. He was dismissed from several positions for unreliability and frequent absences before landing a job at the Havlíčkův Brod ARO in 1998. Despite his troubled track record, he stayed. And by early 2006, he had been promoted to head of nursing shifts, a position that gave him significant autonomy over medication, especially during night shifts when oversight was minimal. According to expert reconstructions presented at trial, Zelenka first experimented with altering patient treatments in the spring of 2006, using sleeping pills and insulin before settling on heparin. Heparin is a widely used anticoagulant, a drug that thins the blood and prevents clotting. In proper doses, it saves lives. In massive, unindicated doses injected into patients who do not need it, it causes catastrophic internal bleeding. Zelenka began injecting non-prescribed heparin into unconscious ICU patients sometime in May 2006. He chose his victims carefully, or rather, opportunistically. They were sedated, unable to see who was administering what. He typically injected them near the end of his shift, so the crisis would erupt after he had left, obscuring the connection between his presence and their sudden deterioration. The first confirmed death came on June 11, 2006. Franciszek Skwarzel, a 68-year-old man, had been admitted for a routine vascular procedure to clear a blocked leg artery. His family was told the operation was straightforward. He never recovered. He bled out internally and died. 6 days later, on June 18th, 59-year-old Marie Henslova died. On June 22nd, 82-year-old Pavel Tlaskau. On July 9th, 78-year-old Ivo Zipa, admitted with a head injury and cardiac problems, succumbed to unexplained bleeding. The deaths accelerated through the summer. On August 23rd, 60-year-old Václav Nový, brought in with a perforated gastric ulcer, bled to death. 2 days later, on August 25th, 59-year-old Marie Shimunkova died following what should have been a routine gallbladder operation. Her family would later sue the hospital. On September 5th, 57-year-old Vera Horakova, a psychiatric patient who had suffered a stroke, deteriorated suddenly and died. The last known victim, 83-year-old Marie Fialova, died on September 24th, after receiving heparin during a ward visit that Zelenka attended alongside the head physician. In total, courts would later confirm 7 murders and 10 attempted murders committed between May and September 2006. The man who cracked the case was not a detective. He was Primář Pavel Longin, the head of the ARO unit itself. In August 2006, alarmed by the abnormal number of severe bleeding episodes and deaths on his ward, Longin began a systematic internal review. He pulled medical records, compared laboratory results, checked medication charts for heparin use that had not been ordered by a physician, and cross-referenced everything against staff duty rosters. The pattern that emerged was devastating. In 23 out of 40 unusual bleeding cases, heparin had been administered off protocol, and Petr Zelenka had been on duty for every single one. Not 22, not 20, all 23. Longin also noticed something else. During a 3-week period when Zelenka was away on vacation, the bleeding crises stopped entirely. When Zelenka returned, so did the deaths. On September 25th, Longin presented his findings to hospital management. What happened next would become one of the most controversial aspects of the entire case. Instead of calling police immediately, hospital administrators negotiated a mutual termination of Zelenka's employment. He was quietly let go. A criminal complaint was not filed until October 16th, and when it reached local police about a week later, it was vaguely worded, mentioning only one possible instance of bodily harm, with no reference to multiple deaths, heparin, or a named suspect. Investigator Milan Justa treated it as low priority, filed it away, and then went on 3 weeks of sick leave. No significant investigative work took place. Meanwhile, on November 1st, Zelenka started a new nursing job at a hospital in Jihlava. It was Longin who forced the issue. On November 30th, having learned that Zelenka was working with patients again, Longin went personally to the police station and gave a detailed statement naming Zelenka and describing the heparin pattern. Within 24 hours, on December 1st, 2006, police arrested Zelenka at his new workplace. During early interrogations, Zelenka confessed. He admitted to 8 murders and 9 attempted murders, though the numbers would shift as the case progressed. But his confession was only the beginning of the questions. At trial, he retracted nearly everything. He claimed police had beaten him into confessing. He said he remembered injecting heparin into only 5 patients. He suggested he was a scapegoat for broader hospital failures. Courts at every level rejected these claims, noting that his injuries occurred during his arrest, not during interrogation, that he had legal counsel present, and that the physical evidence, Longin's meticulous records, the forensic analysis, the expert testimony, corroborated the pattern independently of any confession. But the deeper question of why remained unsettled. Psychiatric experts Wanda Valentova and Peter Goldman examined Zelenka and concluded he was mentally healthy. No psychosis, no hallucinations, no diminished capacity. What they found instead was emotional coldness, strikingly low empathy, and a craving for the adrenaline of crisis situations. They compared him to a gambler, someone who experiences a rush of excitement from high-stakes uncertainty, whether the patient lives or dies. As one expert put it, it was like watching his horse in a race. Tabloid reports quoted Zelenka claiming he heard voices telling him, "Give it to them." But experts testified he never mentioned any hallucinations during formal evaluations. Some commentators suggested he was trying to force hospital management to confront systemic problems, a kind of twisted whistleblowing. Courts found no evidence for this. His motive, as the judges concluded, was self-centered excitement and a desire for control over life and death. His own words at trial would haunt the proceedings. When asked about his victims, he said he took them piece by piece, in Czech, kusod kusu. Investigators later concluded he was likely responsible for at least 3 additional murders, and 1 more attempted murder beyond the 17 counts in the indictment, but chose not to prosecute further because he already faced the maximum sentence. The trial opened on January 21, 2008, at the Regional Court in Hradec Králové. It was described as unprecedented in the country's post-war criminal history. Over the following weeks, the court heard testimony from survivors, grieving families, hospital staff, and expert witnesses in psychiatry, psychology, and forensic medicine. On February 21, 2008, Judge Jiří Vacek delivered the verdict, guilty on all 17 counts. The sentence, life imprisonment in a high-security prison. Judge Vacek stated that with the death penalty abolished, no other sentence would be appropriate, and that imposing anything less would be, in his words, a mockery. Zelenka appealed. The High Court in Prague upheld the conviction in June 2008. The Supreme Court dismissed his extraordinary appeal in May 2009, calling his crimes utterly exceptional in character and scope, and stating that a lower sentence was essentially unthinkable. In November 2009, the Constitutional Court rejected his final complaint, ending all domestic legal avenues. The criminal case was closed. But the institutional reckoning continued. Hospital director Josef Pechel was convicted for failing to promptly report the suspected crimes after Longin first raised the alarm. He received a suspended sentence. Families of victims filed civil suits seeking millions in damages from the hospital, but courts ultimately limited the institution's liability, ruling that primary responsibility lay with the individual criminal. The case triggered nationwide reforms in medication documentation, drug access protocols, and mandatory reporting procedures in Czech hospitals. As of today, Petr Zelenka continues to serve his life sentence in a Czech high-security prison. He will first become eligible to apply for conditional release around 2038, 30 years after his conviction. Legal commentators widely expect that application to be denied. His father, Bohumil Zelenka, has never accepted the verdict. He maintains his son was made a scapegoat and has publicly questioned the evidence and the investigation. But the courts, at every level, found otherwise. 7 lives ended on a ward where they were supposed to be saved. 7 people, František, Marie, Pavel, Ivo, Václav, Marie, and Vera, who trusted that the person standing over their bed was there to help them. The Heparin case remains the most devastating serial murder in the Czech Republic's modern history. And perhaps the most disturbing detail is the simplest one. The weapon was never hidden. It was sitting on the shelf the entire time. What do you think should change in hospitals to prevent something like this from ever happening again? Let us know in the comments. And if you want more cases like this from Eastern Europe, stories the English-speaking world has never heard, like this video and subscribe.